So Ilona was terminating the session on the panel discussion on Sustainable Development Goals, mentioning ambitious leadership. And here on the podium, you see the ambitious leadership of the M8 Alliance. The acting president, Tarek Moroy, and actually Hélène Bourgeois from Montreal, whom you met at the opening. And Hélène is a very ambitious leader, but leadership does not mean only sit in the podium, but also do real work. So Hélène had to do some real work, and she said Tarek is going to represent the leadership from Canada, the presidency, the World Hypertension Summit, the presidency from Montreal in the year 2017. And you also see João Silva, the president of Coimbra University, and Fernando Regatera from also Coimbra University, the medical hospital, and they are the incoming presidents. And this session will be about relaying the baton of presidency from the acting president to the incoming president to the World Trade Summit Regional Meeting 2018 in Coimbra. And I would like to use the opportunity to tell you a little bit about the M8 Alliance. It's a unique leadership organization, very ambitious and indeed unique. It was created in the year 2009. It was called the M8 Alliance because the heads of state of the G8 political leadership group were encouraging us to form a health group which maintains continuity with respect to health programs within the G8, G20 program and process. And in the meantime, we are not 8 major academic centers around the world, but we are 25 academic centers around the world. And in addition, all academies of sciences and medicine around the world, 130 academies of sciences, are members of this M8 Alliance. So indeed, this is a huge, and with my long experience in academic life, I've never seen any network of this kind. And especially, this network is really working. We are meeting at least 3 times a year at the World Trade Summit here in Berlin, at the regional meetings around the world, from Kyoto in Japan to Sao Paulo in Brazil, and to the last meeting in Montreal. And Tarek will be reporting on that, and the next meeting in Coimbra. And in addition to these meetings, we do have various activities, and of course the most important, since we are universities, educational institutions, we are kind of educating, not kind of, we are educating the young leaders. And yesterday you have seen one of the young global leaders, Batu, not yesterday, the day before yesterday at the opening, and you see what can be achieved and the idealism and the spirit which young leaders can develop if the right education, if the right setting is being set. And I think this was, as I said in the opening, an inspiration to all of us. In addition, we do have a systematic young physician leader groups. We get nominations from all over the world, the selection process, and they come to Berlin to the World Trade Summit. They get at the Berlin Management School of Science and Technology a management course in leadership, and of course they have a possibility to participate in the World Trade Summit and get to know leaders, established leaders in the world, which I think for these young people is extremely important. There are many other programs. We have the regional meetings, we have expert groups, and all this then feeds back into the political process, into the political agenda, with more or less success. And as was seen at the last G20 summit, health really has become a major topic of the political leaders. So I think we are doing our best and we are achieving something. Now, this session is about hearing a brief report from the Montreal regional meeting, and Taring is going to give us this report. I then report our conclusions, the M8 declaration of what has been achieved at this meeting and how we take it forward, and then we'll hear the plans for the regional meeting in Coimbra. Tarek, yours is the floor.
Thank you very much, Detlef. Ladies and gentlemen, I was privileged to organize the last World Health Summit Regional Conference in Montreal for North America with my colleague and friend Hélène Boisjoli, who is the Dean of the Faculty of Medicine of the Université de Montréal. And I just brought back this few slides. I had many more slides, but Detlef cut them all back to very few slides. So we had, and Hélène Boisjoli mentioned that before, Canada is a country where everyone comes from somewhere else except the indigenous population. So we had taken our immigration history and the title was Health and Healthcare Delivery in Pluralistic Societies. And this conference was held in May this year in Montreal, 2017. So we had planned this many years before because 2017 is the 375th anniversary of Montreal and the 150th anniversary of Canada. And we thought it was appropriate to hold the conference in Montreal at that year. And last but not least, I'm the head of the RSCM, the Institut de Recherche Clinique de Montréal, and this was the 50th anniversary of this institute. And one of the, of course, you know that Detlef was at that institute, but he was there when it was founded with Michel Chrétien. Okay, so we thought there was reason enough to do this in 2017 with this title. So we had some subtitles, for instance, New Frontiers in Medical Treatment, and this subsection included medical research, also rare diseases. We had health and healthcare delivery for specific groups. We had presentations from the indigenous population, very big problem now attacked by the federal government of Canada with several initiatives. We had environmental, social and cultural determinants of health, and of course we had medical education for optimal healthcare. And you probably know that the curriculum for medical education of the Université de Montréal is one of the best in North America. So Université de Montréal has pulled its weight on this medical education topic. We had fantastic speakers, and since Canada is a bilingual country, I had to slip in one French slide, of course. Nobody noticed, but now you can see it. So we had two ministers, the federal ministers of health, Jane Philpott, and the provincial minister of Quebec, Gaetan Barrette. We had Dr. Heyman, who is a director of an indigenous health service in Australia, and we noticed a lot of common problems and common solutions between indigenous health in Australia and in Canada. Very interesting talk. We had Joanne Liu, who is a professor at the Université de Montréal, and you remember her presentation a couple of days ago, always very touching and underlining the courageous woman Joanne Liu is, being president of Médecins Sans Frontières. We had Brian Hodges from the University Health Network. We had Janet Rasson, a very prominent and notable scientist from Toronto and the Gairdner Foundation. And we had Tim Caulfield from Alberta. And that's already my report. It was a fantastic conference due to the participation of many of you who are in the room and a nice collaboration between my institution, the RCM, and the Université de Montréal, and my friend and colleague Hélène Boisjoli, for who I'm speaking because she cannot be here today. Thank you very much.
Thank you, Tarek. It is now my privilege. Can you move on the slides? Next one. My privilege to report to you the take-home messages which were summarized from this year's World Health Summit, October 14 to 17. The mechanism is that this is being prepared, circulated, and then kind of summarized at the end, the final day of the meeting. And this is the first presentation of the M8 Alliance Declaration, World Health Summit 2017. First point is, and this was emerging in many discussions, health is a political choice. Global health is increasingly shaped in the political arena. For the first time, the heads of state of the G20 included priority global health issues in their final declaration. I'm sure you have seen that in the newspapers worldwide. Health is recognized as a centerpiece of the Sustainable Development Goals 2030 agenda, which we have just been discussing, and it is now a regular feature of the UN General Assembly. The member states of WHO have elected a new Director General with a strong commitment to the right of all people to universal health coverage and to gender equity. At the same time, global solidarity for health is challenged by a wave of populism all over the world. So this is not guaranteed, and it's a continued challenge to maintain health as a political choice and a positive decision on this. This year's World Health Summit sends a strong message that determined political leadership is required to counteract forces that endanger global health progress. The rich discussions at the 2017 World Health Summit led us to highlight the need for action of 6 key areas for global health. Commitment to 1, strong and reliable governance; 2, ensuring global health security; 3, healthy and resilient cities; responsible approaches to big data, number 4; 5, research, innovation and development; and 6, health systems strengthening, especially in Africa, as a focus at this summit. Number 1, strong and reliable governance. The world needs strong global health institutions to set norms and standards, respond to outbreaks, and to protect and support the most vulnerable on this earth. We call for that the countries hosting the next G7, G20 summits and which hold the presidencies of key regional organizations to include global health challenges on their agendas and to make the political choices required to ensure the implementation of the 2030 SDG agenda. 2, ensuring global health security. The world is not yet ready to respond sufficiently to a major pandemic threat, despite a range of new initiatives which have been created to support greater health security for all. And we call for decision makers to maintain and strengthen their investment in health security, especially the implementation of the IHR. We call for the fact that this must include ensuring the safety of health and humanitarian workers in war and conflict zones, and you know what we mean by this. We call for investing in resilient health systems and capacity at community level to ensure greater safety and reduce vulnerability. 3, healthy and resilient cities. Cities are becoming transformative drivers of sustainable development and key actors in global health. Their challenge is to act for health locally and integrate health into urban planning, housing, investment, and social policy decisions as cities continue to grow and change. Now we have about 50% of the world population living in cities. Soon it will be 70 to 80%. We call for increasing the number of city initiatives and networks that support health and the need of mayors to give particular attention to the social determinants of health and the impact on the next generation of children and young people. 4, responsible approaches to big data. Data are increasingly a cornerstone of healthcare in all sectors, including industry, and its value is rising exponentially. The digital future of health has only just begun, and in many cases outpaces the policy responses. We call for international organizations and on policymakers to prioritize the digital potential of health systems and to rapidly and systematically address the ethical, commercial, regulatory, and technical challenges that come with this change. 5, research, innovation, and development. Progress in global health is driven by great scientific progress and innovation in health research. We call for countries, private sector actors, and international organizations to significantly step up their investment in innovation, science, and technology, including implementation sciences, interdisciplinary and translational work, as well as technology transfer. 6, innovation and health system strengthening in Africa. Achieving the Sustainable Development Goals will require significant innovations regarding how investments and partnerships are being developed with low and middle income countries around the world, but especially in Africa, as discussed at this meeting. We therefore call for professional organizations to actively contribute to new models of institution building and professional development to promote indigenous capacity in science and technology. We call for strategies to develop a highly competent health workforce, as well as managing workforce migration and circulation. First successes in Africa show that progress is possible. They must be stepped up and they must be supported. The M8 Alliance renews its full commitment to support goal number 3 of the Sustainable Development Goals, which aims to ensure healthy lives and promote well-being for all at all ages. We call on heads of state and governments to invest in people and to ensure that no one is left behind. The M8 Alliance commits to the transformative approach of the Sustainable Development Goals. Success in SDG Goal 3 will only be achieved through a cross-sectoral approach involving many of the other SDGs. We call on politicians to make the political choice for health. Thank you very much. That's the declaration. You are the first one to hear the final version. This will now be distributed, and as has been discussed by Ilona and the panel on SDGs, this, of course, now will be distributed to everybody concerned, and you may be asking yourself why the political choice is put in the forefront, because we feel that there is much in danger, and this is one of our first address, but this, of course, is not saying that all the other partners in academia, in the private sector, in civil society are not the addressees of these M8 Alliance goals and calls for action, and we actually will address to our partners after this meeting in the academies special calls for action, which then will be broader distributed, go to all national governments, and hopefully change the picture and improve global health in the way we all have been discussing during this meeting. Thank you very much. This was one small step, and the process is going on, and we are looking forward. And João and Fernando are already waiting to present the next step, discussing what has been achieved, discussing what these declarations have been able to move on in the various areas we are going to address, and possibly define new goals at each and every step. So may I ask João and Fernando to come up front and tell us about their plans for Coimbra.
Well, good afternoon. We certainly will be very happy to welcome you in Coimbra, and I think it's very clear from the presentation that has just been done and the discussions that have taken place during this conference why we have chosen the motto for Coimbra, which is Frontier Medicine. Frontier in the sense of healthcare being delivered under difficult circumstances. Sorry. I would like to welcome you to the University of Coimbra. I certainly expect you to be there next April. Coimbra is a very old university. It was founded in 1290. It's one of the oldest in Europe. It's one of the very few that has been considered World Heritage by UNESCO. And it's been considered not just because of the beauty of the buildings, of the architecture, but because of the impact it had in the world. It's good to remember that the Portuguese were the actors of the first globalization, and we were spread around the world, and so we think that we can certainly make a contribution from this knowledge, ancient, profound knowledge on the world, that we can make a contribution to the global development goals, these sustainable development goals of the United Nations, and certainly to the M8 Alliance. It's a very beautiful place. I certainly hope that you are going to come also to know the place. It's been in the same place since 1537. It has probably the most, or certainly one of the most beautiful libraries in the world, Joannina Library, that has been inspiring people for a number of centuries. It's also been, this is just an example, a place where many things happen. These are the instruments of the Enlightenment period. It's the only place where you can still find them in the original setting where all the new discoveries in the 18th century of physics, chemistry, electricity, and so on were studied, and classes were given to students. The building itself is a very old one. It's more than 1,000 years old. It was originally a castle, a defensive castle. You can look from this perspective that it does look like a castle. Now it's a castle of knowledge, no longer military. It has lots of buildings, colleges around the old university. This is the venue of the conference. It's a renovated monastery, an old monastery. It's a conference center of Coimbra. Quite beautiful town, I think. I hope you agree, and certainly when you visit us. And I obviously expect you to be there. Please mark the dates for 19 and 20 April next year. I will now pass to my colleague Fernando Regateiro, who is going to give you a quick overview of the program.
Thank you. So I'm there. In this venue, we will have these approaches with keynote, workshops, networking events. And the main topics will be managing infectious diseases in low and middle income countries, opportunities and challenges in translating innovation into healthcare, governance for health equity in low and middle income countries, and biomedical education for changing the world. The preliminary program is done. The most part of the main speakers are assured, and the opening session is closed. We will have politicians, our Prime Minister. We will have keynotes by Jim Yong Kim and Carlos Moedas. Other keynotes are done, are prepared. Pardon? As this one, Melinda Gates to be confirmed, Matchidais Moet Rebecca, Monica Ferro. The closing ceremony is closed, almost closed. Antonio Guterres to be confirmed. Our President of the Portuguese Republic is confirmed. I am confirmed there. And I myself, I asked you a couple of minutes, only a couple of minutes, just to say, before receiving our baton, to address an enormous thank you to Professor Detlev Ganten and all members of WHS for this fantastic World Health Summit 2017. Thank you, really. For me, it's a great honor to be here. It's my first time in WHS, and already with such a huge challenge as being responsible, together with my colleague, the rector of the University of Coimbra, for organizing this regional meeting, and both becoming acting presidents. WHS, through the integrating of the prestigious collaborative networking of 29 worldwide academic medical centers, universities and academies, reaches high levels of fundamental and clinical knowledge and expertise, and generates a high level of value added. Facing this, two options were available: the capture of generated value by members of WHS, or to create positive externalities. The option has been naturally to externalize. WHS regional meeting to be held in Coimbra next April 2018 will be another event to serve WHS vision as before, this time namely directed to Africa. We are deeply honored to receiving you in Coimbra next April. See you there. Come to the button, please.
Thank you very much. Now, if you go to Coimbra, I'm sure this will be a wonderful meeting. You will probably see the rector in a fantastic traditional ceremonial outfit. Now, this group is not as ceremonial, but we have a small ceremony which you are actually witnessing today the first time. And this is the change of the presidency, and the acting president, Tarek Moroy, also on behalf of Hélène Bourgeois, will give the baton now to João Silva and Fernando Rigatero, the new presidents of the World Health Summit 2018. This ends the ceremony, and now the work goes on. There's nothing to do. Thank you. Thank you. Very good. Thank you.